since 2011 really. That's when I first started GP training. So I graduated in, got my degree, my fellowship in 2013, and have been moving around, well, primarily trained in South Australia, so living in Mount Gambier for a bit of time, and then various practices in Adelaide before making the big move to Victoria. Yeah. I like general practice because of the variety that walks through the door. You don't really know why someone's coming to see you, but also the continuity of care, so you get to see you know, the whole family really. And in terms of complementary medicine, you know, I think that's just a great tool to look at things more holistically. You know, we look at, you know, lifestyle and diet and you know, things like trauma and you know, mental health issues, and we look at a whole range of things together to get someone back into well-being. And I think we've got a bit more extra time here. There's no so much of that time pressure, so we've got time to take a more thorough history, get to know the patients a bit better, you know, find out what impact stress has on their health, you know, or where that disease process has actually come from. So not just sort of treating the disease itself, but actually trying to find out where it's come from, and looking at all the different factors that could cause the body to be in dis-ease. I think they value the time that we spend with them. I think they realise, I guess in terms of the questions I'm asking, you know, it's a little bit more in depth. So I think they feel that they are listened to a bit more as well here. And then we, you know, come up with some testing that we might do, and some of the tests might be a little bit different from from mainstream. And then we come up with a bit of a management plan from there. Yeah. Yeah, it's definitely a nice space. You know, you walk in and it has a nice energy about it. You know, some clinics that I've worked in before can be quite, what's the word? Maybe drab's not the right word, but you know, it's not an inviting space, or I guess maybe a feeling of wellness maybe around. Yeah, so I think it's a good energy. Yeah. I definitely think so. I mean, being, so my background is Malaysian Indian, so, you know, with being Indian, there's an Ayurvedic component of medicine, which was what I was initially quite interested in sort of pursuing, but then sort of found integrative or complementary medicine, and that really I think has a balance between Western medicine and evidence-based complementary medicine, and I think that's a nice fit for me. And you know, you can see where, you know, mind-body medicine is important, and how stress and trauma can affect the disease process and affect the body. So I think definitely my culture has made me more open-minded to that. I do. I like my B vitamins. I have heaps of patients who feel so much better once we get B12, or even just a general, you know, B supplement, getting those levels up. Yeah, so that would be my favorite, B vitamins. Yeah. Energy levels, more sort of cognitive improvement, so they feel mentally more alert, helps with mood, but I think the biggest is in energy levels. Yeah. Health motto: let food be like medicine, and medicine be like food. I think it's just going back to basics. You know, a lot of chronic disease comes from a poor diet, and you know, sort of in this day and age where processed foods are so readily available, sometimes it takes extra effort to eat well, to eat organic, to eat, you know, locally sourced seasonal foods. So I think if we can get back to eating like we used to all those years ago, we can really help reduce the amount of chronic disease burden.